Ovarian cysts, are they cancer or not cancer? Let's find out. Hi, my name is Priscilla Akila. I'm a medical doctor in Nigeria for now. I'm passionate about making you learn, laugh, and love. And on this episode, I'll be talking about ovarian cysts. So, what are ovarian cysts? Ovarian cysts are fluid-filled sacs that are usually formed on the ovaries. The ovaries are part of the female reproductive organs, and that is what usually produces the egg that meets with the sperm to form a baby. So ovarian cysts are basically of two types. They could either be functional or pathological. The functional cysts are the ones that are associated with the function of the female reproductive system. That means that it is formed during the normal female menstrual cycle. Right, so what happens during the ovulation phase of the menstrual cycle is that there's usually the release of the egg from the ovary, and when the egg is released from the ovary, it usually comes hoping to meet a sperm. When there is pregnancy, the egg, let's say this is the egg right now, breaks, and then the content of the egg is the one which meets with the sperm to form the baby, right? So what is left is now the eggshell. So that eggshell in quote is called the corpus luteum. So ideally, this corpus luteum is meant to dissolve if there's no pregnancy. But if there's pregnancy, it can be maintained for some time, and then it's meant to produce a hormone called progesterone, which helps to sustain pregnancy for some time.
Nice one.
In cases where this corpus luteum does not dissolve, it could become fluid filled, and that is what forms the ovarian cyst. That's the functional cyst that is associated with the menstrual cycle. The pathological cysts are not like that. They are abnormal growth, and they could either be filled with fluid or with solid material. So what are the causes of ovarian cysts? Sometimes there's no particular cause of an ovarian cyst, but as we saw in the functional type, it is associated with the menstrual phase. That is due to hormonal changes that occur in the female, and then it's also commoner in women who are of childbearing age. So it could occur in any woman of any age group, provided you are a woman and you have ovulation going on inside of you. And then genetics could also predispose people to having this ovarian cyst. And if someone had an ovarian cyst in the past, that person is likely to have another ovarian cyst. What are the symptoms someone with ovarian cyst would have? Someone will have varying symptoms. Sometimes there could even be no symptom to an ovarian cyst. But when there are symptoms, it could vary from bloating, abdominal pain, that's around the pelvic region, that is down there, spotting or bleeding. There could also be irregular menstrual periods and sometimes infertility, and that is because it alters the menstrual cycle due to the hormonal changes. And how can it be diagnosed? Ovarian cysts could be diagnosed by taking history from a patient and knowing how it came about, especially history of the menstrual cycle of that patient, and then examining the patient, specifically carrying out a pelvic examination for that patient. And ultrasound scan can also detect an ovarian cyst. And sometimes laparoscopy or during surgery, ovarian cysts could sometimes be diagnosed incidentally, and that means that there was no prior intention of wanting to discover an ovarian cyst. There was no symptom in the first place. It could be that that person just went for a routine checkup and had a pelvic ultrasound scan done and it was discovered, or the person just went in for surgery for something else and then the cyst was discovered inside the pelvic cavity. Ovarian cysts are treated usually depending on the patient's presentation and the size of the cyst. For patients with functional cysts or without any symptoms, they could have watchful waiting done, in the sense that that patient may not have any medication or surgeries at the time, but would be observed for some time to see if the symptoms progress, worsen, or abate. So when the symptoms abate and the patient is fine, then there's no need for any medication or further treatment. But in the case where that symptom gets worse and the patient is uncomfortable, then that patient may require some hormonal therapy or surgery, especially when it is becoming life-threatening. So what are the causes for alarm in a patient with ovarian cyst? 1, severe pelvic pain and also heavy bleeding, and then a patient with some form of altered sense of consciousness following some of these symptoms that I've mentioned already. That patient should be quickly taken to the hospital for evaluation. Ovarian cysts could be complicated by torsion, that is turning on your own, rupture, and also malignant transformation. Malignant transformation means the simple cyst, or the cyst that was just benign initially, now becoming malignant, which is cancer. And as I said, for any of these things, for any worsening of symptoms or something you do not understand, please see your doctor. And of course, ovarian cysts may not necessarily be preventable because there are causes that are beyond your control, like the genetics and the fact that you're a woman, and then you have hormones that may have some imbalances at some time. But you could do yourself well by having regular exercises, having good and healthy diets, generally taking very good care of yourself, and you'll be fine. Thank you.